Okay, hi. So, hello everyone. My name is Sanah Murtuza, and thank you for joining my internship presentation. So, a little bit about me. Um, so, I have an undergrad degree in Bachelor of Dental Surgery, and I've worked as an associate dentist back in India, and then I worked as a medical data analyst in a bioinformatics company. And right now, I'm pursuing my master's in biomedical and health informatics, and I'm doing my internship at InNeed Intelligent Cloud. So, talking about InNeed, it is a cloud-native IT consulting company associated with one of the biggest cloud computing platforms like AWS, which helps customer build new revenue streams, save infrastructure cost, increase efficiency, and deliver advanced technology solutions like serverless app design, big data analytics, AI ML, mobile apps. So this allows retrieval of vital insights from diverse data-driven sources, producing reports and dashboards, establishing centralized data systems, and developing finely tuned ML models for various contexts. So InNeed has worked on projects in collaboration with UNC Chapel Hill, like IPICS, which is Interactive Prostate Cancer Information, Communication, and Support, and AMI, which is Analytics and Machine Learning for Maternal Health Interventions. It is dedicated to mitigating maternal mortality and morbidity during pregnancy. So through data analytics and machine learning, it helps identify risk factors for high-risk mothers, helps to enhance maternal and fetal health, and positively impact the lives of expectant families. So I've had the opportunity to work for and be a part of the project IPICS. So IPICS project was awarded funding through the US Department of Defense. It is a HIPAA-compliant program designed to improve communication and decision-making for patients with localized prostate cancer. It operates on an AWS cloud and RedCap-based client-server model. It is an interactive multi-module application that collects, stores, and analyzes patient EHR data. It uses machine learning to facilitate personalized care, adhering to data exchange standards such as HL7, JSON, and FHIR. So this project focuses on improving patients' knowledge, mental well-being, and decision-making process. This is how the interface of IPICS looks like. And it has three subsystems, which is the Inform, Dialogue, and Snap. So the first is Inform. It brings together personalized education and trustworthy health information from Medline Plus. Through reinforcement learning algorithms, IPICS Inform creates user profiles based on input, influencing customization of information and presentation for a more user-friendly experience for patients and caregivers. Second is the IPICS Dialogue. It ensures trustworthy patient-provider communication through a secure messaging system and records synchronous conversations with automatic transcripts. So integrated with the Inform, it uses advanced technologies like named entity recognition and supervised neural networks to enhance accuracy, allowing patients and caregivers to easily search and personalize their history of queries, concerns, and treatment discussions with providers. The third is IPICS Snap. It facilitates professional and peer support by employing NLP tools for effective search and visualization. So serving as an online community forum, it allows patients and caregivers to share information, engage in dialogues, and interact with providers, ensuring accuracy through nurse moderation. So integrated with other systems, users can easily share discovered information or inquire about topics discussed in IPICS Inform or IPICS Dialogue. So the data set used is the NIH-funded data set, which incorporates 77,000 participants from 8-year trial with both clinical and social determinants of health variables, and DoD-funded data set, which includes around 2,000 male participants from 5-year trial with clinical data and significant emphasis on social determinants of health. So the technical system architecture will integrate and analyze both the social determinants of health and clinical factors from the data set using machine learning techniques incorporated with components of AI to provide accurate and personalized treatment recommendations. with associated risk information so that patients are involved in the decision-making in their treatment journey. So these are the stages of IPICS. First is the co-designing of the prototype. The research team and InNeed developers co-design the prototype through focus groups and qualitative interviews with the patients, caregivers, and providers. Then prototype development process, user feedback and refinement, like the IPICS content, flow, design, functionality, finalized based on focus group and interview results. Data collection and analysis, HIPAA and privacy considerations. IPICS development is compliant to HIPAA standards using a secure server, which is the Amazon S3 storage, and with restricted access to designated individuals. Pilot evaluation design, participant samples and procedures, data collection and measurement, and data analysis, which is descriptive analysis of IPICS using tracking data and participant feedback, provided insights into user satisfaction, perceived usefulness, ease of use, and decision-making improvements. Another project I had the opportunity to work on is the Quantlio. So it aims to provide physicians and clinicians with information relevant to the accurate treatment of patients. The project objective is to build a system to collect all the relevant information from different sources, like from LIS, FDA, and from NIH using their APIs, and generate a report in a specific format that will include drug-to-drug interactions and contraindications. So basically, it helps reducing medical errors, improve patient safety by notifying them, providing real-time alerts, helping with informed decision, lower medical insurance cost, and helps to avoid adverse drug effects. So this is a typical workflow of the Quantlio project. So the lab collects samples and patient data. It sends it to the LIS system. And currently Quantlio has two LIS systems, which is Dendy and Stratus. The LIS system shares the data with Quantlio system via their API interface. Quantlio extracts and stores the data in their database. InNeed develops the data shared for dashboards or other systems like the EHR, and the results are generated and sent back to the end user, which is the LIS, in the form of PDF reports. And then Quantlio analyzes the data and queries the external databases. So the stakeholders are InNeed, along with the offshore team, which is in Bangladesh, Quantlio members, the LI systems, which is Dendy and Stratus, labs involved is Salvis and Newstar, and the healthcare practitioners. So since my role was more of a business analyst, the tools that I applied are Microsoft Excel for data entry and storage, calculations and formulas, project management, like preparing Gantt charts and timelines for project planning, tracking, data visualization, timesheets, and scheduling. Also, I used Microsoft Project, which is for project planning, Gantt charts, task dependencies, timeline visualization. And also my learnings throughout the internship has been learning about AWS cloud services, like computing service, storage, database, networking, ML, AI, security, and DevOps tools. And hopefully I'm planning to get a certification in AWS practitioner exam by the end of this month. At the end, I would like to thank Mr. Shamim, sir, for helping me and guiding me throughout the internship and trusting in me with the projects. Also, Tamjeed for being my mentor and supporting me throughout this internship. And I would also like to thank Jenny, Mariel, and Erica for supporting me from the beginning and also for answering my last minute questions. That's it. Thank you.